I think we're going to get started. As a matter of introduction, I guess we're streaming live on Facebook tonight. And so I'm Dr. Robert Lawler. I'm a board-certified obstetrician gynecologist. I've been practicing in Downers Grove since 1993. And about 3 years ago, I opened up my own solo practice in Downers Grove after being in a rather large group for 20 years prior to that. So Elizabeth Traynor and Patrick had asked me to come up and speak and answer some questions, and I'm so grateful for whoever provided this wonderful list of questions. Tonight's lecture is one of my favorites because it's not me necessarily lecturing to you, although I'll answer these questions. I hope it can be kind of interactive in that we can learn from each other, and that's what I find most enjoyable. So a lot of this, it's going to be like you and me are in my office alone and we're just talking, although I know I have a group of men and women. I don't see men in general. But I hope to just share with you, what I share with my patients and on a daily basis, and try to answer these questions just as truthfully and honestly and faithfully as I can, and hopefully we can learn a little from each other. So it's a give and take. So thank you for having me, and I appreciate being here. My practice is a unique practice in that many years ago, 15, 17 years ago, I decided to make my practice completely in conformity with the magisterium of the Roman Catholic Church. And in doing so, I try to provide the very best health care, but at the same time, still within the confines of our beautiful Roman Catholic faith. And I think it affords women a level of health care that they're not accustomed to getting right now in the United States. So with that, and before I start these questions, and we're just going to go through this wonderful list that Elizabeth provided for me, I think it's always good to start with prayer. So I'm going to start with one of my favorite prayers. I do think we're in very trying times in this country. We need to pray for those weakest among us, both the very, very young, the baby in the womb, the very, very old, the patient in the nursing home, and the imperfect, those who would be deemed less desirable, the Down syndrome babies, the trisomy 18 babies. We seem to become a society that disdains the imperfect, and that's to our detriment in the long term. So, in the name of the Father, and the Son, and the Holy Spirit, amen. Saint Michael the Archangel, defend us in the day of battle. Be our safeguard against the wickedness and snares of the devil. May God rebuke him, we humbly pray. And do thou, O Prince of the heavenly hosts, by the power of God, cast into hell Satan and all evil spirits, who prowl through the world, seeking the ruin of souls. Amen. In the name of the Father, Son, and Holy Spirit. Amen. All right, so right to this list of questions. Question number 1. What are the best NFP methods and why? Wow. Why not right outside the gate, So, natural family planning, fertility awareness. Our practice is very, very supportive of all forms of fertility awareness. Little time for a disclaimer. I went to medical school in Omaha, Creighton University, where they developed, the Creighton method. Tom Hilger's out at the Pope Paul VI Institute, NAPRO technology. I am a consultant for NAPRO. My My wife and I practice fertility awareness, Billings method. So when I see a couple and they are interested in learning about fertility awareness, I first start by just some basic science. And the basic science really applies to whatever method you want, be it Billings, Creighton, Marquette, symptothermal. They all center around some basic science. So here it is, guys, NFP 101 in about 3 minutes. When we talk about fertility awareness programs, what we're looking at is we're looking at certain signs that help the couple identify ovulation when they're most fertile. And fertility awareness programs actually originated as a way to help couples to achieve getting pregnant. And then along the lines, we decided that we were getting very good at this and that this would actually be a licit form of spacing children within the Catholic faith if there were grave reasons for doing so. Now, I think sometimes we forget that, and the Catholic Church has left grave reasons vaguely defined, and maybe we need a little more guidance along those lines, but that's a magisterial question, not a Dr. Lawler question. I'm not a theologian. I'm not an ethicist. I'm an OBGYN, a Catholic OBGYN trying to live his faith 24/7, right? And not just on Sundays. So I didn't just want to come to work and then say, okay, well, you know what? That's great. Rome, wonderful. But you know what? I live in the real world. I practice in the real world. And so I'm going to do secular things in my office. And I sort of rejected that. I wanted to be Catholic, authentically Catholic, 24/7. So back to the science behind fertility awareness. What we're trying to do is identify when a woman is most fertile. And one of the most outward signs of a woman's fertility is her mucus production. And when you're part of NFP or fertility awareness, you have sort of a fascination, if you will, with mucus. And mucus is beautiful. Why mucus? Mucus is so important. We consider it the gateway to fertility. If the mucus is present, pregnancy is possible. If mucus is absent, it's not going to happen. So mucus is there, gates open. Mucus isn't, it's closed. And so all of the various methods that I mentioned, the 4 main ones I mentioned earlier, really center around the presence or absence of fertile mucus, defined as abundant, clear, stretchy, and lubricative. All right? And we know that fertile mucus precedes ovulation, and then peak mucus correlates quite nicely with ovulation. And then you can use this information to help a married couple have a baby. Or if there are grave reasons for not having a baby, then abstain during that time and still be within the church's teaching on licitness. Now, what makes it so effective is a few facts that, unfortunately, we got this data, although we sort of knew it pre-IVF, but IVF sort of confirmed this data, and it goes as follows. When a woman releases an egg, it lives for 24 hours. Of that 24 hours, it spends about 12 hours undergoing change called capacitation, where the outer shell of the egg becomes penetrable by a sperm. So really, you're only fertile for about 12 hours. And then after that 12-hour period, you're not going to get pregnant that cycle. A man's sperm has a finite life as well, about 5 days. But its capacity to fertilize an egg drops off dramatically day to day. So if we have an egg that can live for 24 hours, it can be fertilized for 12, and we have sperm that can live for 5 hours, or 5 days, excuse me, then you can see that if you follow and look for the signs of fertility, that you can start to make some really good estimations on when you should have relations if you're trying to conceive, or flip it on the other side, you can avoid or abstain, show some self-mastery if you're trying to space your children. And so that's the mucus part of it. And all of the forms, be it Billings, Creighton, Marquette, symptothermal, all have mucus as their center in some degree. And then it gets, a little bit, they kind of branch off and they add little things here and there. But that's the basics. So which one is the best? It really, I don't think one size fits all. And I know the Creighton people might say, well, ours is the best. And Billings, no, ours is the best. And symptothermal, you guys don't know what you're talking about. And then Marquette says, no, we've got the monitor. Right? So when I look at my couple, we talk about all four, and we sort of get a feeling for, what method fits them best. Symptothermal, which is actually taught by the couple-to-couple lead, adds temperature taking to their fertility monitor, their cycle monitoring. Temperature typically goes up after ovulation. So you can imagine it's probably not too good of a sign if you're trying to avoid getting pregnant, because it's already, the cat's already out of the bag and the temperature goes up. However, it's a nice way to reaffirm your observations. So there's definitely a learning curve with any kind of fertility awareness. And I think that's where it gets sort of a bad rap, especially from my colleagues who don't really know that much about fertility awareness, and they go, oh, that's the rhythm method. That's Vatican roulette, because basically, you're going to be back and you're going to be pregnant within, if you're trying to avoid, you're going to be pregnant in no time whatsoever, because there's a 25% pregnancy rate using the rhythm method. NFP, fertility awareness, is not the rhythm method. It has nothing to do with the calendar. Absolutely not. It has everything to do with observations. And those, so cycle length means nothing. Basically, what we're looking for is the presence or absence of fertile type mucus, and we need to learn what that looks like. And then, depending on what method, be it symptothermal, are we seeing a shift in the morning temperature? Or Marquette has introduced a fertility monitor which follows certain urinary hormonal assays that change as ovulation approaches, and some people really like that technology, although there's an added cost to that. You have to buy the monitor, you got to buy the strips. And then Creighton basically takes Billings and standardizes it, they would say. And they would say, not only do we have a standardized teaching model that all of our practitioners throughout the country go through the same training, are talking the same language, a common language. That's how Creighton would say sets them apart. And then the whole idea of charting as a diagnostic tool really was brought to the forefront by Tom Hildreth out in Omaha and his what they call natural procreative or NAPRO technology, which, you know, can be a diagnostic tool based upon identifying peak mucus. When you hear the words peak mucus, you think ovulation. So is there one method that is the best method? I don't think so. And in my patients, I think that you have to be open to that fact that, you know, maybe somebody really likes the Billings and somebody likes Marquette and others like Creighton and Simple Thermal. So that's, I think it's an advantage. I know that those instructors of a given method feel strongly that their method is the best, and they should. But as an OBGYN, I certainly wouldn't move somebody off one method if they feel very comfortable doing it to change them to something else, unless there was an issue. So I think they're all wonderful, and they all have their advantages and disadvantages, which I think are just innate to the various methods. Here's a great question. What are the warning signs that something is not normal in a woman's cycle? Great question. So the things I think of in my married couples is if they're having lots of bleeding after intercourse on their non-menstrual days. That patient needs to be evaluated for any kind of abnormality of her cervix, cervical cancer. Are her pap smears up to date? Is there a polyp hanging off her cervix that is bleeding all the time? Or irregular bleeding, bleeding that has no pattern to it whatsoever. You know, there again, that should warrant a visit to the gynecologist. Or heavy, painful, drenching periods, there again, not normal, okay? These are the kind of things that a woman who's charting can actually detect and bring to your attention. Case in point, I had a patient, she was actually using the Creighton method, and her fertility chart coach was noticing this really, you know, distinct pattern of erratic bleeding and especially bleeding after intercourse that was just persistent. And so she did the right thing. She sent her to us, and sure enough, we diagnosed, you know, a severe dysplasia, not a cancer, a precancerous condition, easily treated, and as soon as we treated it, you know, that type of bleeding pattern went away. So charting can be a real lifesaver in certain circumstances. Under what conditions should a young, not sexually active woman, young girl, see an OB-GYN, an OB-GYN? Well, first of all, I don't think, as a general rule, we don't see teens or preteens. We usually refer them to pediatricians. However, if a young woman, a virginal female, is having heavy periods, is having severe premenstrual syndrome, is having terrible acne, I think those are all good reasons to see a gynecologist. And I think what's important for those young girls is to know that the gynecologist isn't going to examine you. They're going to basically talk and sort of get an idea and look at the patient. What's their hair growth look like? what's their body habitus, okay? Where are they at in their weight, BMI, things like that. I think we can make a difference, and sometimes it's just an exam on a young female like that, I think is more traumatic and doesn't provide any additional information that we would need. So, and that's what I'll tell moms when we get this question. It wasn't asked here, but when should girls see a gynecologist for the first time? Well, certainly, if she's become sexually active, she needs to see a gynecologist. Absolutely, positively. There is a nasty infection out there, guys, that is so prevalent, and it is so insidious, and it is underdiagnosed because we just don't see these women enough, and that's called chlamydia. Chlamydia is so destructive to a woman's future fertility. It's been estimated that after one episode of treated chlamydial infection, so you've diagnosed it, you treated it, there's up to a 20% infertility rate associated with that infection. After 2 treated chlamydial infections, the infertility rate can be up to 50%. So it's so destructive, and I guess, when we'll talk about another question, and when these young women are on the birth control pill, all of those signs and symptoms of pelvic inflammatory disease are somewhat muted. They don't feel as bad. And you think, well, that's a good thing. Pain's bad. No, it delays the diagnosis, and it gives that infection longer time to set up in the fallopian tubes where it does the most damage, and the damage can be permanent. Wow, we're jumping all over. I love it. What are the best ways to approach your current disbelieving doctor? What resources can you show them? Wow, I'm taking it. It just I would imagine what you mean by disbelieving. People who don't, doctors who don't really feel that natural family planning is a reasonable way to prevent pregnancy. I think you need to provide them the resources like One More Soul. Pope Paul VI Institute has a great website. The American Association of Pro-Life OBGYNs is a great resource. Listen, I think what's important is, unfortunately, in the majority of OBGYNs in this country, if a teenage girl presents and states that she wants to be on the birth control pill, that the majority of OBGYNs are going to give her the pill. And the train of thought is, listen, we want you to engage in safe sex, okay? And this is one way of engaging in safe sex. I'm here to make a statement tonight, controversial as it may be. The only safe sex is sex between a married man and a married woman. That's it. Everything else, you're fooling yourselves. You're just kidding yourselves. You can call it safe. You can say, well, I'm on the birth control pill and I'm using condoms. You know what? Somebody said once about youngsters who are sexually active, they don't make a condom for the heart. And I really believe that. I've seen so many distraught, hurt, young, beautiful women because they felt that if they weren't sexually active, that Prince Charming wouldn't love them anymore, or that they weren't being a real woman, and that we as physicians have bought into this narrative, which I think is insane. I used to say, I would no more hand you a pack of birth control as I would a pack of cigarettes. It doesn't make any sense. Think of what you're doing. Save yourself. You're worth it. You're worth it. That's the message. You know, it's this whole, you know, you see so many young girls who learn very, very hard lessons that after they have given something away that is so special and they can never get it back, that a lot of times, shockingly, the boy loses interest, right? Been conquered. And they don't understand what they are actually doing. We need more self-control and less birth control. And this whole notion that this is somehow being responsible, it's just irresponsible. And it's irresponsible on the physician's part as well. We are supposed to be the advocates to these young women. So many of them just want to hear no. So many of them just want to have somebody act like an adult and say, wake up, think about what you're doing here. You know, if he really loves you, you know, I'll steal a line from Janet Smith. Look him in the eyes and tell him, you know, do you want to have babies? Whoa, wait a second. I love you. Yeah, no, but do you want to have my baby? You know, it looks just like you. Well, you know, no, I love you. No. You know, I'll give you the definition of love. Remember this. Love is to will the good of another. Remember that. Love is to will the good of another. Think about that in every situation where sex comes into play. I don't care if it's heterosexual, homosexual, to will the good of another. Love does not equal desire. Not the same. If you truly will the good of another, you're not going to participate in an activity that should be confined to marriage and whose primacy is the begetting of children. Begotten, not made. Remember that. Should teens do full charting? If not, when should a woman start? Well, hey, some have described charting as sort of another vital sign, you know, respirations, pulse, temperature, and a woman's charting. I think if somebody's interested in the physiology behind it, knowledge makes those things less scary. But I also think sometimes charting can become a little bit mechanical, especially in a relationship. And that's where God comes in. So I think it's fine for a teenager who's interested in learning more about her cycles to chart. But I think also sometimes you can overread the charts and sort of want to intervene, if you will, if the chart doesn't look pristine. And remember this, you're not machines. You're human beings, beautifully made. And so take the textbooks, take the charting, and take it for what it's worth, but it's not gospel. And you're not this perfect, you know, menstrual cycle that we see in the textbooks. It does, you know, a lot of things work into our makeup. Stress impacts us. We see the most irregularities in charting very early and very late. And that's when they become the most challenging, especially in our couples who are trying to space their children. What are the best methods to track postpartum? Okay, so now we're talking about a woman, she's had her baby, and how do you know when you really started ovulating again? One of the biggest challenges, especially in our breastfeeding moms, because breastfeeding is going to have a suppressive effect on ovulation. Full-time breastfeeding, meaning you're the only source of nutrition for your baby. There's no bottles, there's no cereals, you are it. That's called ecological breastfeeding. And it's very, very effective at spacing children. When you start to introduce other forms of nutrition to that baby, then it becomes less effective at inhibiting ovulation. However, you should start to see a resumption of the fertile mucus. And what I'll tell my patients is that if you see fertile mucus, believe it. Believe it. Now, some patients will say, gosh, I see fertile mucus all the time. Well, there's another question about that. And there may be certain circumstances where the Marquette method may give an added sense of security. Dr. Lawler, we just had number 7. And we're 22. Wait a second. No, we just had number 7, and we're open to life, but we think we think we're at our limit right now, and we're nervous, but we want to do God's will. I hear it all the time. I think in those circumstances, that's a fertility coach is invaluable. I'm not a fertility coach. I mean, I can read the charts, I can diagnose problems, but it's these wonderful, typically women, who not only using the method, they've really spent the time to look at the intricacies, and they give a lot of confidence, because you got to have confidence in your method, whatever that method is. You got to believe in it. So, but those are the challenging times. The other challenging times is the woman who's in her mid-40s, 45, 46, and her fertility is beginning to wane. The fertile mucus isn't as clear as it once was, and they're thinking, well, maybe I'm 46, 47, I'm not ready to be a mother again. And sometimes it happens. And I might add that every patient that's ever happened to has always said it was the best thing in the world that ever happened to me. God knew what I needed, and it's beautiful. What are the differences in your care versus a non-Catholic doctor? Wow. I would think it only comes down to this, is that what don't I do that a Catholic or non-Catholic doctor might do? I don't prescribe contraception. I don't perform sterilizations. I don't refer for abortions. And I don't refer for in vitro fertilization. Other than that, there's...
What about the testing in the beginning? Yeah, I know some of now might be mandatory that I don't even know about anymore, but there's all those testing that we know what a lot of the testing is for.
Oh, sure.
Can you opt out of those? I mean, I always did opt out of any of those.
Oh, you mean, okay, so when we're
how do
talking,
you handle
right, and
that?
that was actually a question, so we'll jump in it. So, is there a problem from a Catholic's perspective of doing the tests that screen for spina bifida, Down syndrome, any kind of chromosomal abnormality?
Yeah.
Catholic Church has no problem with those. The problem I have with them, and the why I would say probably 99% of my patient population. Now, I am a niche practice, you know, which would, you know, would not probably want that testing, is that these tests, and what we're talking about, are non-invasive tests to screen for problems with your baby, with the idea that if it comes back abnormal, it will either lead to an invasive test that could possibly harm your baby, or pressure will be put to bear to talk you into terminating your baby, killing your baby. And in Illinois, at least, you should offer everybody. We're sort of mandated to offer all testing, and we do. California, unless the patient opts out of it, they do it, which I think is ludicrous, because basically what they're doing is then they're bringing to bear on this woman this notion that not all life is worth living, and you would be better off just wiping this one out and going on and try again. And that's why I think the test is so destructive. But the test itself is, you know, some Catholics would say, I want the test because I want to be prepared. That's reasonable. I don't have a problem with that. Most practicing Catholics would say, hey, it is what it is. My baby's my baby. And, you know, if you've ever met a child with Down syndrome, they are the face of God, folks. They are the face of God. I mean, they light up the room. They literally light up the room. And so that kind of testing, it's fine, and I have no problem ordering it. But certainly, I think when you do order a test like that, the couple needs to understand, okay, this is a screening test. It's not diagnostic. It should not be acted on. The problem is a lot of doctors are acting on that screening test. So there's a potential that they are terminating a normal baby. And that has happened. That's documented. It's happened. They've terminated normal babies based on the screening test. What do I mean? If the screening test comes back suggestive of Down syndrome, suggestive of some other sort of chromosomal abnormality, then there should be an invasive test where they do an amniocentesis, draw the fluid out, and actually check the chromosomes of the baby to be definitive. Now, what's the problem with that? Well, amniocentesis generally is very, very safe, okay? But is it 100% safe? No. You're sticking a needle into the fluid around the baby. Sometimes complications happen. Now, can you imagine, and this is, I'm bringing it up because I've seen it. Can you imagine a couple who gets a screening test done, and the screening test comes back positive for Down syndrome, let's say. And so they want to go forward with a definitive test, and they undergo an amniocentesis. And they're that very unfortunate, rare case that loses their baby after an amniocentesis. And then 2 to 3 weeks later, they get the results back, and they're normal. That's hard to accept. That is life-changing. That is a lifetime full of regret. We lost our baby. Our baby was normal. And if we wouldn't have done this you-know-what test, we would never be here. That's a lot of regret to live with. But it happens. Very rare. Very rare. So that's basically the difference. And we pray in our office. I pray. You know? Anytime you think your successes are your own, beware. You know? Your failures eat too, you know? Do you have resources for pregnancy loss and fatal diagnosis in your practice? Sure, absolutely. And I work at a Good Samaritan Hospital in Downers Grove. We have a great program, great perinatal services. The program called SHARE is for couples who experience loss, and it's a great loss. And it makes me cringe when you hear an 8-week mom have a miscarriage and doctors say, "Oh, you know what? You'll be fine. You'll get over it. You'll have another." That's not what they want to hear. They want to hear, "I lost my baby." Okay? And early miscarriage is very, very common. It's the reason why when a mother carries her baby to full term and she delivers that baby, the vast majority of those babies come out what? Perfect! Right? Perfect, but we just take it for granted. Everything that has to go right. And it does. It does. There has to be a creator. All right. Any young, I think we can answer this one. We're grown. Okay. Oh, do you work with Catholic doulas that you recommend? I don't know a Catholic. I mean, it's interesting. I think everybody knows Dr. Lawler's Catholic, but I don't know the people, I don't know my colleagues. I think colleagues, physicians, nurses, they'll come up to me if they feel comfortable, but I don't know if a doula has ever came up to me and said, "I'm Catholic doula."
What's a doula?
A doula is like a person who assists with delivery,
It's like a labor
sort of a support, a layperson support person. And they're, it's.
That's what all my kids are. There is, I didn't want to answer it, the person asked me, there is like a Catholic Association of doulas.
Yeah, I'm not aware of that, so I would, that'd be great. All right, adult question here. Okay, how is pulling out not the same as abstaining during the fertile period if the end goal of avoiding pregnancy is the same? Great question. Why is NFP any different than contraception? You're basically, you become so effective, or so you say. What's the difference? Why? What's the difference? And I will contend that fertility awareness, if used with a contraceptive mentality, you may have a valid point, may. However, if you are participating in the conjugal act, and the conjugal act is not interrupted, then that, meets the criteria set forth by the magisterium that every conjugal act should be, has a unitive and a procreative side, and it should be open to life. And so therefore, it is different in that if you think of the word contraception, right, against life, so as you can imagine, the total giving of a man to a woman, which happens in a conjugal act, is not really total if you say, "Oh, wait a second, I have to put on this sheath," or "I'm going to pull out," or "I want you to take a synthetic hormone, so I want all of you," not quite. I want it close, but not everything. I'm giving myself to you 97%. Okay? You get it? It's not a total giving. It's not a surrender. But we've become so hypersexualized in our society that it's become a recreational activity, and we've forgotten about the unitive and the procreative. We've eliminated the bonding that takes place with this beautiful act that should be reserved for married couples. I know that sounds really, really old-fashioned, but it's the truth. And this is where kudos to the Catholic Church. She got it right, and it is right. And I will just give you one little statistic, and you can look this up. We know what the divorce rate is in the United States. It's hovering right around 50%. All right? That's the divorce rate. And we know that Catholics and non-Catholics contracept just the same, right? And that, so Catholics will use contraception just as much as non-Catholics. Do you have any idea what the divorce rate is amongst couples who practice natural family planning? So the baseline divorce rate, let's say it's 40 to 50%, which seems just astronomically high, but that's what the data says. What is the divorce rate amongst couples who practice NFP?
1 or 2%.
It's less than 1%. So if you want to make your marriage last, you practice fertility awareness. Why? Because it involves both couples. It involves decisions. It's open to life. Is it easy all the time? No. But God never said it would be easy. He said it'd be worth it. But it's not easy all the time. There is a certain amount of self-mastery. And we're not perfect. We're going to fail sometimes. But that doesn't mean we stop doing those things. And that's why I think fertility awareness, natural family planning, really trumps all other methods of spacing your children. As long as Catholics, practicing Catholics, remember that the church considers it licit as long as there are grave reasons for spacing your children. Remember, you're only fertile for 12 hours of the month. And God says, you know what, for that 12 hours, if the conditions are right, then I'm going to join with you and we're going to make an immortal soul. And that's what happens. Father Thomas Loya, said that the uterus is basically a tabernacle. It's the holiest place on the earth. And you would think that it would be one of the safest places for little girls and little boys. But in this country, it's one of the most violent places, which is sad. It really is sad. When you think of this notion of choice, choose what? Choose a violent act? You ever think about, we never want to talk about what happens in an abortion. Oh, Dr. Lawler, please, I don't need to know that. I know what it is. No, you don't. Because if you knew what it is, you would never, ever allow it to happen. Oh, but what about rape and incest? What about it? What did that baby in the womb do to you to allow you to execute that little girl, that little boy? Nothing. Abortion is a violent act. It's not pretty. It's not nice. And until we get that through our heads, that it's forceful entry, you're knocking down a door and you're kicking out the inhabitant, piece by piece sometimes. I know. I'm with Father Frank Pavone, with Priest for Life, in that we've got to speak the truth. And sometimes, guys, the truth is really, really ugly. And I think there was a butcher in Philadelphia by the name of Hermit Gosnell who just showed us what evil really looks like. What evil really looks like. I pontificated, I'm sorry. Okay. How can we help a spouse who is not on board with NFP, especially with specifics of teachings? It's tough. I mean, I know there's a lot of husbands who are, just, sitting there and they're going, I don't believe it, this doesn't seem right, I don't like this, it doesn't work, we're gonna have another baby, I can't afford another baby. And I think it takes time, and it takes time for an OB to really sit down and explain the science, explain why it does work, show them the data that it's very, very effective. Yes, there's a learning curve. Certainly, pregnancies can happen, but you know what? You're participating in an activity that primacy is to make babies, right? So that if a baby comes from it, it's not a sign that something went wrong, right? It's a sign that something went right. And when it comes to contraception, right? Think about it. What other area of medicine do we prescribe potent synthetic steroids to treat an otherwise healthy condition as though it were a disease? High blood pressure? No. Diabetes? No. High cholesterol? No. Fertility? Yes. It's like, holy cow, it's the baby in the womb has become public enemy number one. And it's going to ruin your life. But we want it all. We want it all. And we want it now. Wasn't that? I think that was a song. I'm not going to break out. This is a great question. Okay, so another disclaimer. I have 11 children. I know, but you're thinking, oh my gosh, and he practices NFP. Oh, boom, the guys are leaving. Why in the world should I trust NFP if everyone I know that uses it has lots of kids? And my current doctor thinks it's crazy. Well, there again, disclaimer, my wife and I, when we went to pre-Cana, I kid you not, that was the old days where the priest put you in one room and they're in their other room, and you had to fill out the questions, didn't know, and then you bring it together and you have to go over. And so we're sitting there in front of Father, and he goes, "Did you guys talk about this?" No, I didn't know what to expect. "Be sure." "All right, I've never seen this before. Good luck. You say you want 10 kids? She says she wants 10 kids. What's going on, And we got 11. So we wanted a big family. And I think that certainly, fertility awareness helped us achieve that. But we were taking a more providential approach, if you will, early on in our marriage. But for every couple who uses fertility awareness, who has a large family, I know couples who have grave reasons for not having children, either health, financial. The church doesn't define what grave means, and I think justifiably so. Although, I will tell you two things right off the bat, if I was keen. One, is it grave reasons to, we just got married, we want to, see the world, we want to pay off our student loans and, get out of debt? No, stop right there. If you're ready, and I'm going to borrow a line from another priest, if you're ready to get married in the Catholic Church, you're ready to have children, period. Don't wait. I think we could eliminate so much heartache and infertility if couples would just be open to life as soon as they get married. Time is not your friend when it comes to fertility. It's not. So have those babies early. You will be abundantly blessed, and you can't imagine your life without them. It doesn't detract from you. It adds. It adds, multiplies. It's the best thing in the world. So many times, people, when you have a big family, people feel like the filter's off.
Oh boy.
Don't you know? You know how they make them, don't you? Oh yeah. What are you going to do with it? You can't possibly love them all. I think I can. well, this is irresponsible. Have you thought about your carbon footprint? Yeah, have you seen my food bill? Come on. But there again, then people, in my job as an obstetrician, I can tell you so many times, oh, Dr. Lawler, I'd give anything to have more. I wish we had more. I just think, we just didn't think it through, and he got a vasectomy, or, I had my tubes tied, and I regret it. I regret it. So don't be there. If you're getting married newlyweds, enjoy your marriage and be open to children early, because you're never going to be more fertile than when you first get married. I truly believe that. What are tests to ask for to rule out common issues? I'm not quite sure what they're getting at. Fertility issues, maybe. There's a workup for infertility, the basic workup. Might be a little bit. Literally, we could be here till midnight. We might come back to that. Oh boy, two big ones here. Why is birth control? I'm assuming the pill, but that's changing. Why is birth control so bad? Most people use it. It's true. A lot of women use it. I don't know if they like using it. Well, I think it's bad because I don't think it's good for a woman to chronically consume synthetic steroids in order to override a normal physiologic function of her fertility. And that I think it's also being a little naive if you think that you can take synthetic steroids month after month, year after year, and not pay a price for that. And that's a whole lecture unto itself. I also think that when you think about how contraceptives work within the body, they are potent estrogen-like compounds, progesterone-like compounds, progestins, and they are not only affecting your reproductive organs, but they're affecting your brain, they're affecting your circulatory system, your lungs, and your heart. And so, why are they bad? Because I don't think a woman's was meant to be exposed to that chronically for years and years on end. And I think the interesting thing is that unfortunately, I think the American College of OBGYN, which is a very pro-contraception, I guess the leadership would be considered pro-choice, if you will, which I think you call it pro-abortion, has embraced this idea that pregnancy is to be avoided at all cost, that especially in our young unmarried females, that to talk about abstinence is just so naive, so beyond the pale, that you would be laughed out of any kind of medical conference to even suggest that a young woman and a young man have the capacity to abstain from sexual activity, and that, just bringing it up as a medical doctor isn't very medical at all. And I just totally disagree with that statement. I think it's our job, if we are going to be the advocates of these young people, young women in my situation, they need to hear about abstaining and waiting. And I think the pendulum's kind of turning a little bit in our favor, guys, in that I'm seeing more and more newlyweds coming to the office expecting their first child who have waited until they got married before they engaged in sexual intercourse. And I would love to take them out on my lectures with me because it's possible. It's possible, and they're just beautiful couples. Beautiful couples.
Can I ask a question that
Yeah.
piggybacks off of that? What about people who say that they're using the pill as a medical treatment? Like, for example, I've got polycystic ovarian syndrome, and every typical OB that I go to just tries to give me the pill and tell me that, oh, this will fix you, and then when you want to have a baby, we'll do. And we have a couple children, but
Yeah.
I've just been told that that's my only option.
I disagree.
I agree.
Okay, so let's say polycystic ovary syndrome, endometriosis, painful periods. Does the pill fix anything? So let's say you have endometriosis. Your periods might feel better on the pill. They may not, but they might. And now you've gone along 3 or 4 years on the pill, and then all of a sudden you decide, I want to start my family. Is your endometriosis gone when you go off the pill?
It's worse.
No, it's probably progressed. It's probably worse. The inflammatory process has taken place. So what I would say to that young woman is, hey, we've made the diagnosis of endometriosis. We've treated it surgically. We've destroyed what we can. And I think as a matter of informed consent that in your situation, once you're married, I would start my family sooner rather than later. Don't let this chronic process continue on. But this idea that the birth control pill cures anything is just folly. It doesn't.
Do you have any tips on like discussing that with OBs? Like I've had lots of health complications related to polycystic, and I've basically been.
So ask them, and when, okay, so you want to put me on the pill, will I still have polycystic ovaries when I get off the pill?
Right, but they say, well, but it treats it for now, like you're having an issue right now.
What are you treating? I don't get it. Well, honestly, I think the pill has dummied us down. Dummied OBGYNs down. It's much more difficult to sit down and try to really get at the root of the problem, right, than it is to pay somebody and suppress the problem. It's the analogy is, you see a fly, I think of Aaron Rodgers, that commercial. But that's kind of it. The fly on the glass table, you can hit it with a fly swatter or you can hit it with a sledgehammer. Both ways the fly is dead, but the table's destroyed. Well, if the only tool in your toolbox is a hammer, every problem looks like a nail, right? You're just gonna, oh, acne, birth control pill. Oh, bad, heavy periods, birth control pill. And then if you want to be sexually active, birth control. We never think about what we're doing to these young women. And I think a nasty little secret is that if you would actually survey board-certified OBGYNs whether or not they would want their daughters on the birth control pill, I think you'd be shocked. That survey's never been taken, but I went around a meeting once and just said, okay, you want your daughter taking the pill? I don't know, I'd probably talk her out of it. Oh, really? But it's okay for your daughter to be on the pill. I don't think it's good medicine. And what's interesting, kind of a segue, is that, my practice is a very Catholic practice, right? But we treat people from all faiths or no faiths whatsoever. And the biggest bump in patients coming to see Dr. Lawler now have no religious affiliation whatsoever. They would be classified, I'd classify them as organic, tree-hugging, green people, right? And the one patient, she was wonderful. She goes, yeah, I heard about you, and I was sitting and she was with her husband, and they go to organic food, everything, and her husband just kind of laughed, and he goes, yeah, dear, you've take such great care of yourself, you do everything organic, but you consume a synthetic steroid daily. And she said, it's like the light bulb went off in my head. And I said, and so she goes, so she was attracted to the natural part of natural family planning. And that you could call it green sex, or you could call it whatever you want. She was working, right? She was working with her
Is it
system.
gluten-free?
Right. And she didn't want to know anything about my religion, my Catholicity. She could care less, but she wanted to learn about how her body worked. And I thought it was beautiful. And I said, amen. I didn't say amen. I said, okay, I can teach you. And so we met. We found common ground. The common ground was, she was wonderfully made. She didn't know it, but she was, and she is. And she's happy that she's gotten off this chronic exposure to synthetic hormones. And so that was a really, and I'm seeing more and more of these, because, those green people, they hang around. And, so that's good for Dr. Lawler, because Dr. Lawler's got 11 children.
Well, historically, when they were first inventing the pill, there was an equal one for men also.
There was. It's a great story.
But they knew that women were better pill takers.
Well, I think the story, there's a great book out there, it's not in print anymore, called The Bitter Pill. And in the pill, what we're talking about is, there was the study that was performed in Puerto Rico. That's where we went to investigate the pill initially. And there was a prominent Catholic physician by the name of John Rock out of Johns Hopkins who was instrumental in really bringing the first pill to market. And the fact that he was a daily communicant, problematic for the Catholic Church. And the first pills were so high dose that their main mechanism of action was that of an emetic, meaning the woman would take them, was throwing up all the time. She didn't even have any idea of having sexual relations, right? But in the Puerto Rican study, 4 women died. 4 women died in that study of cardiovascular events, blood clots to the lungs. They had a parallel study going on. I want to say they were Yale medical students, and they provided steroids enough to inhibit spermatogenesis in the males. But one of the males had shrinkage of his testes, which we see in some of our steroid-using bodybuilders and football players and things like that. But so they had shrinkage of the testes, and you would have thought it was a national emergency. They had it. We cannot have that in this country. We have 4 women die on one side.
Right.
Well, what did we do? Did we stop the study? No, we just lowered the dose. That was acceptable. At the time, women were expendable. But we had one male have shrinkage of his testes, and they stopped they stopped it right there. And I think they've been trying to lower the dose ever since to quote unquote make it more safe. And I think now the movement afoot is, listen, we can't get these young women to consume this pill every morning. It makes them feel bloated and breast tenderness, and plus we can't get them to make their bed, right? Let alone make them take a pill every day. So what's the American College's idea? Well, let's take the CNS part out of it. Let's just take this out. We don't need any reason. Let's put an injectable or an implantable or an IUD in them, and then they can have sex whenever they want. They don't have to remember anything. Isn't that wonderful? Still exposed to sexually transmitted diseases and things like that, but that's where we're going. Instead of saying, wake up, stop this, we're saying, no, you know what? Now you don't even have to think. You can go out and have sex with whom and whenever you want, and you won't have to be fearful of conceiving. Just an aside, does anyone know where the IUD came from? I mean, it's ancient. The IUD actually came from ancient Egypt. And of course, when the caravans, the long tracks across the desert, it was hard to keep the camels from, you get a camel, you get lonely, keep the camels, and a pregnant camel on a caravan is a bad idea. So what did they figure out? They figured out by putting stones in the uteruses of the females that they would prevent pregnancies, and that was the first ancient IUD. Oh, doesn't that make you feel good?
Dr. Lawler, one more point I think that's not talked about a lot with the pill
Yeah.
is this idea of spontaneous abortion.
Absolutely.
People don't talk about it. Even people that are in the know or faith-filled
So the
forget that
question
stuff.
is mechanism of the pill. So the initial pill, which was developed by John Rock, was so high dosed because John Rock understood that the only chance he had of convincing the Catholic Church that this was licit is that if he could absolutely guarantee that ovulation was not taking place. Because if you had a breakthrough ovulation, then you've got problems, right? So what am I talking about? The main mechanism of the pill is it inhibits ovulation by fooling your body into thinking you're pregnant, right? The second mechanism of the pill has to do with what we started this wonderful night out with. Mucus, right? What does the pill do? It's progestin dominant, it thickens the mucus, it makes it hostile to sperm transport and nutrition. So now we've thickened the mucus, all right? We've inhibited ovulation, we've thickened the mucus. Okay, both of those, still not listed within the Catholic faith, but they're both contraceptive mechanisms, right? The third mechanism, and it's in the package, you just have to pull it out, it says impairs nidation. Oh, that's not the good. Hey, have you been nidated today? No, what in the world is that? Well, nidation is when the newly formed life implants into the wall of the uterus. So it impairs implantation so that the lining becomes very thin and barren, right? And so when that new baby wants to implant into the wall, there's nothing to implant into. There's not that nice fluffy lining, and so it gets flushed off. Now, for those of us who believe that life begins with egg and sperm unite, fertilization, that's an abortion. And it's an intended abortion because that's one of the mechanisms of action. Very difficult to know how often that mechanism is acting. There was a Dr. Colleton who actually did the numbers, crunched the numbers, and you can imagine, take 10 million women and just take a small percentage of 10 million women, all right, and then take that month to month. How many babies are we aborting in a given year in this country? If you believe, as I do, that life begins at conception. Now, the American College knows this, and so what did they do in 1965 or so to sort of kind of, head the train off at the pass, so to speak? They got a conference together and said, okay, you know what, we had a problem here. Instead of pregnancy being defined as when egg and sperm unite, let's make it when implantation is complete. Oh, see that? A little subtle difference, right? So pregnancy, defined by ACOG somehow, is after implantation. So what is it before implantation? Well, I don't know. But it's not, it's not a pregnancy. It's something other. Well, what kind of garbage is that? Come on. But you can understand why they did that. It's why the makers of Plan B can say, we don't interrupt pregnancy. Because in their warped way of thinking, a pregnancy doesn't exist until implantation has occurred, right? I know it's semantics, but it's important because I can't tell you how many patients have said, if I would have known that third mechanism was possible, I would have never have gone on the pill. I thought I was contraceptive, which I knew was wrong. Okay. But it wasn't that wrong. Okay, all right. Well, you could argue that back and forth, but I think there's a total lack of informed consent when it comes to contraception, when it comes to in vitro fertilization, and certainly when it comes to abortion in this country. We don't want to know the humanity that's within. And we all know what happened last year at the Super Bowl with Doritos. They made the most pro-life, and that commercial was yanked so fast, I actually jumped out of my chair when I saw it for the first time, and I'm sitting there with my wife, and Paula, Doritos just made the most incredible pro-life commercial. They made the baby in the womb a baby, a human. And what was the next quote the next day? How dare Doritos make the baby a baby? I kid you not. You can look it up. They came out and said,
How dare he humanize a fetus?
yes, how can you humanize this fetus? And it was, you can't make this stuff up. But if history has told us anything, if you want to kill something in mass numbers, what do? You dehumanize it, right? You call it anything except what it is. So we went from fetus to embryo to pre-embryo to blastocyst, but never call it a baby. And how absurd is it in this wonderful country of ours that one person can arbitrarily assign value to another, so that the baby in the womb at sometimes has infinite value, my baby, or it's a blob of tissue and I want it out. Oh, really? Interesting. How many of you have ever gone to a fetus shower? Oh, I'm going to a fetus shower. Oh my God, what fetus,
What do you buy a fetus now?
What do you buy? What's your fetus? Oh, thank you. Oh. So come on. The truth is so evident, but we're afraid, we're scared. We have to support these young women, and we have to push for ultrasound to show the humanity. All right, I told you I have a gift of the gab. Let me think. I think this is a great question, and I think I'll end with this one. Is it morally problematic for a woman to have an endometrial ablation done for heavy bleeding? No, it's not. And the Catholic Church's teaching on that is, well, they haven't actually weighed in on it. But when you're treating a woman, typically, if you're going to treat her for heavy bleeding with an ablation, of course she should be done. She should be at that point in her life where she doesn't want any more children, not because the procedure itself is in any way a sterilization, but that pregnancies that occur after an ablation can be very high-risk pregnancies. The placenta just doesn't want to come off that uterus. NFP, fertility awareness, since you're not treating the cervix or the endocervix, the signs of fertility are still there. You're treating the lining. But it should be reserved for those women who are trying to avoid a hysterectomy, and it's very effective. And we do them. But with the caveat that, look, this in no way represents any form of sterilization. And pregnancy is possible, and it would be a high-risk pregnancy. Now, that having been said, I did have a woman who had an ablation at age 40, not my patient, and she came in at 46, and she was pregnant. And she went through the pregnancy, she, of course, shocked, you know, but went through the pregnancy, delivered by C-section, had to do a hysterectomy right after the C-section because that placenta wasn't going to come off. And what was so beautiful was after the shock, it was about a year later, she's 47, she goes, you know what, God is so good. When I first found out I was pregnant, I thought, oh my gosh, what's my life going to be like now? And after this beautiful baby came into the world, I got on my knees and just cried because I doubted God, and my life is so much better. And you know, now she's a woman in her mid-50s now, and it's beautiful. So I think with that, we covered 90% of these questions. I talked way too long. I appreciate you being so attentive, and I'm open to any questions, public or private. And thanks for having me up. But it's a privilege, and God bless you all.